Is your blood safe enough to save life?
Life is a beautiful gift each of us possesses. With life comes love, ambitions, achievements, and celebrations. Much as we cannot share the life we have with others, we can offer something of substance that can make someone's life better. Blood. Sharing is caring. Safe blood equals quality life. In Uganda, now and again there is an increase in demand for blood transfusions in hospitals, and this in turn raises the need for blood donation all over the country.
Blood transfusion is a service, of course, now undertaken by the government of Uganda in trying to save life, which can be done in so many ways. One of them, of course, is through now blood donation.
And when we talk about blood transfusion, there are very many people who really need this blood. We have sicklers, we have mothers in hospitals, we have victims of accidents.
In cases of diseases like now sickle cell, so now these children or even adults keep on breaking down the red blood cells, and by so doing they reduce the level of blood. So to counteract that, we need now to get something to add on, which we are able to achieve through blood transfusion.
Fahad is a sickler who almost lost his life had it not been for the availability of safe blood in the hospital that day.
The last time I received blood was when I had a lengthy visit to the village. I would feel sickly. I would feel a lot of fever at night. So when I was rushed to the nearby hospital and diagnosed, I had malaria. And there is when sickle cell children and all people with sickle cells have malaria, it also affects their level of blood.
So when red blood cells break so much in sicklers, one, they'll be anemic. That's the sickle cell anemia. And these individuals really need transfusion.
When you don't have enough blood, you can even fail to eat sometimes. You can even start losing the ability to talk to people. And when I received the blood, I started feeling a lot of general body strength. I started feeling better. You can even immediately ask for food.
With Fahad's health restored, there must have been a good Samaritan who spared their time and went and donated blood. In Uganda, blood donation is mostly dependent on voluntary donation, and the need for blood increases at a rate of 20% per year. However, much as there is a deficit in blood collected, there are certain measures undertaken to ensure blood safety. Those who are HIV positive, have syphilis, hepatitis B, hepatitis C, sicklers, cancer patients, patients with heart conditions and lung diseases like TB, those with high-risk occupations like sex workers are permanently deferred. Then we have those who are temporarily deferred from donating blood. Those who are sick with common illnesses like malaria, those with fresh tattoos on their body, and pregnant ladies are not allowed to donate blood for up to 6 months.
So before blood is donated, we make sure there is a blood bag, and then there is a side pouch of the blood bag. Usually the pouch in the blood bag contains blood of some amount, 30 to 40 mils of blood. It is now from that pouch that we pick blood and then check for one, the blood group of the donor. Two, the TTIs.
When we talk about TTIs, these are transfusion transmissible infections, and we have series of them. We have HIV, we have hepatitis B, hepatitis C, we have malaria and syphilis. After donating, they take these bags to the testing center. Yes, that's Nakasero. Mango has also started testing. So they have a very good machine with very high sensitivity that not a single passes out.
However, the process of blood safety is not entirely up to the health workers. You as a donor have a role to play as well.
We have questionnaires whereby you tell us your age, we get records of when did you last test for HIV, for all the TTIs. We get also informations like number of sexual partners, so that we get a clear picture that the person going to donate is 100% eligible.
Why is your information so important? Well, a lot of resources are used to collect blood across the country. More resources are used by the blood bank to group, process, and test the blood for transfusion transmissible infections, TTIs. Blood that is found to have any of the TTIs is considered unsafe and therefore discarded. So by keeping yourself free from these infections, you reduce on the quantity of blood discarded, hence saving the government resources that would otherwise be wasted.
So if you had intentions of lying, you're really deferred. After a specific time, you can donate, yes.
Therefore, your honesty towards answering the questionnaire saves time and makes it possible for people like Fahad to receive blood when in need.
I would like to encourage all people out there in Uganda and the world over that blood really saves people's lives.
We are all potentials to receive blood. In short, recipients for blood. Today it may be me. Who knows? You may be the next tomorrow.
After all, in the end, all that matters is the impact you had in other people's lives. Sharing is caring. Safe blood equals quality.